Hi, I'm Tasha Munter.
I'm Mary Schweitzer.
I'm Devin Mock.
I'm Kate Bockenberg, and we're doing a video on hypovolemic shock, and we're MSU nursing students.
The causes of hypovolemic shock: acute loss of circulating fluid, which results in decreased venous return to the right heart with decreased stroke volume and cardiac output, resulting in decreased perfusion at the tissue level. Hi guys, I'm Tasha from AMR. I have a 22-year-old male. His name is Devin. He was involved in a high-speed MVA this afternoon. He was restrained. There was some compartment intrusion on the vehicle. The airbags were deployed. Upon my primary survey, his airway is patent. His lung sounds are equal bilaterally. His pupils are equal and reactive to light. Rapid head to toe, he had a small laceration on the top of his forehead. The bleeding is controlled. He has no other deformities or bleeding, other than he does have a very distended abdomen with severe pain upon palpation. Vitals are blood pressure 120/80, heart rate at 128. He is on a high flow non-rebreather because he is tachypnic, and I started 2 large bore 18 gauge IVs in each the left and right AC. He is confused and restless, GCS of 11. Skin is pale and diaphoretic, and his pulses are weak with sluggish cap refill. Do you have any other questions?
What fluids do you have running?
Okay, I started normal saline, and he's got a 500 ml bolus so far en route.
Sounds great.
Okay.
Signs and symptoms of hypovolemic shock. Early on, your body will compensate and will show a normal blood pressure, an elevated heart rate, restless and confused mental state, pale, cool, and clammy skin, pulses diminished with sluggish capillary refill, tachypnea, respiratory alkalosis, and diminished urine output. Later on, the body is non-compensated. The blood pressure is starting to drop. Heart rate is lowered with a decreasing mental status. Cold and cyanotic skin with now weak or absent pulses. Dysrhythmias, bradypnea, resulting in respiratory acidosis and anuria.
Hi Devin, I'm Kate. I'm going to be your nurse today. Can you tell me your full name and birth date?
Devin Mock, 12/30/91.
Can you tell us where we're at?
Mm-mm.
Can you tell me who the president is?
My boy Barack,
Can you tell me what day it is?
July 7th, 2009.
Let's get another set of vitals.
Cascading effects. Due to blood loss or fluid loss, the body reacts by having a decreased cardiac output, decreased blood pressure, and decreased tissue perfusion, as seen in this diagram on the left. Those cause cell hypoxia, intracellular fluid loss, and decreased venous return, and many other things. In the diagram on the right are the compensatory mechanisms that fight these cascading effects. First, the sympathetic nervous system is activated, which releases epinephrine and norepinephrine to increase contractility and vasoconstriction, which helps increase blood flow to vital organs such as the brain and the heart. The RAS system is also activated to help increase blood pressure and venous return.
I'll listen to his lungs and his heart.
Blood pressure is now 90/50. Heart rate is weak, 42. O2 stat is dropping. It's now 84%. We need to prepare to intubate.
I don't hear any bowel sounds.
Treatment of hypovolemic shock includes oxygenation. If the patient's airway is patent, we will put them on a high-flow oxygen non-rebreather. If the patient does not have a patent airway, we will need to intubate and ventilate. We will need to fluid resuscitate with normal saline or lactated ringers and plaqued red blood cells, plasma, and platelets. Additionally, we will need to treat the underlying cause. Supportive cares include keeping them warm and pain management.
I'll call the lab, we'll draw some ABGs, get a CBC, and then a ball profile.
I'll call the blood bank to get a type and cross. We'll need packed red blood cells, platelets, and fresh frozen plasma. I'll also fast scan him to see what's happening in his abdomen. The fast scan is showing us positive free fluid in the left upper quadrant.
I'll start a Foley. We need to make sure we get some accurate ins and outs.
The nursing considerations for hypovolemic shock include obtaining lab values, hematocrit and hemoglobin, ABGs, a metabolic profile, and lactate. Nursing interventions include neurological assessment, vital signs, hemodynamic readings, urine output, skin color, and temperature. Nursing diagnosis, altered tissue perfusion related to decreased cardiac output, and inadequate oxygenation related to poor gas exchange.
Hand in the blood. We have some lab results. Hemoglobin is 8, hematocrit 25%, bun at 30, creatinine at 2, lactate at 2.5, and a blood pH of 7.32. These labs are showing decreased kidney perfusion, blood loss, and poor perfusion at the cellular level.
If hypovolemic shock is not successfully managed, complications turn into the refractory stage. These include coma, severe hypotension, ischemia, which results in ischemic and necrotic extremities, renal failure, hepatic failure, and eventually death.
Okay, he's getting cold. We need to get the bear hug around him, blowing some warm air on him.
Hi guys, I'm Tasha with the OR team.
What was the report from the doctor?
Well, he just called me and said upon CT that he does have a ruptured spleen, so we need to get him down for emergency surgery.
Okay, this is Devin. We have normal sinus rhythm, bradycardic, his blood pressure is dropping, his abdomen is distended. We have him on 100% oxygen, non-rebreather. 2 units of blood have been rapidly infused.
Okay, and how much fluid has he gotten so far then?
He's gotten 1,000 milliliters normal saline before we hung the blood.
Okay, and how's his pressure been right now?
Dropping
Okay.
rapidly.
Okay, well we're gonna get him loaded up, the OR team's ready for him, and get him down to surgery and get him repaired.
Awesome.
Alright, thanks.
In conclusion, rapid intervention with adequate oxygenation and fluid resuscitation will lead to hemodynamic stability.